Hmm.
Happy Friday, everyone. We're having a great time here already, and I'm sure you will, and I hope you have been having a good time today. As I'm here with our Total Traffic and Conversion team, Roy Dickan, Betty Withrow, and our guest today is Frank Garcia, and we're going to talk about Social Security and health insurance in a minute. But I have a shameless self promotion to do first. So we sometimes joke about these broadcasts that we have like tens of people who watch the show, right? Anyway, I the other day I was looking through my LinkedIn analytics, and it said we had like 500 one week, and so I just checked out to see what we had for the year, and there we go, 21,128, and that's just for my LinkedIn alone. And this right now, at the moment, we're streaming this out to. I've got 5 Facebook properties. I'm sending it out to, and YouTube. Sometimes I can go to Instagram or Twitter, but I don't know what happens on Twitter. I think that's where the crazies hang out, really. But it is an option. And Roy, you're streaming this out to
LinkedIn.
LinkedIn, and Betty.
Oh, yeah, Facebook and LinkedIn.
Yeah, so we're out at what's that?
Mm-hmm.
13, 11 anyway. My math is a little suspect here. So anyway, so that's going out, and I'm kind of excited that we're actually getting some traction and some views here, and we sometimes couple this with as blog posts. So we've had broadcasts where we've gone live, and then an hour after the show, you've searched on Google search, and we could find the video on YouTube and the LinkedIn and the blog posts all at one time. So this is working. So my shameless promotion is that's what we do at Total Traffic Conversion. And if you want that kind of exposure for your business, then give us a call. And yeah, I also have a shameless little banner here to put up here. It says, "Get her done." Anyway, so Frank here, and Betty and Roy know Frank. I have not met him before today, and so all I know is that you're one of the things in your background is you're a Golden Gloves champion, and I had a friend who was a Golden Gloves champion, and I just have to say, if you've never had boxing gloves on and tried to hold your arms up for any length of time with people trying to knock your block off, it's hard to understand how exhausting that can be. But anyway, why don't you introduce yourself before we totally slander you?
I appreciate that. Thank you for the opportunity to be on the show today. I always enjoy speaking and talking to people, and helping people is part of my background. I came to California quickly in 1982 as a amateur boxing champion, and thought I could be the heavyweight champion of the world. So I came here and turned pro with a family, and I had 6 pro fights. One pro fight is still on YouTube today, and I did win it. So, but it took me a couple of years to realize that I was not going to be the heavyweight champion of the world, and I went into the insurance business right away. So I've been in insurance for 30 something years and helping people with retirement planning and this stuff. One of my most recent things that I've acquired through continuous education and training is I'm a registered Social Security analyst. So that has really helped me to help people that are planning going into retirement 3 or 4 years before that. So to get them ready to realize that they're going to be doing something that they haven't done before, which is not working as much and living and retiring on the money that they have. So that's just a little something. Married to Lori, going to be 26 years this coming the 25th of this month. She's a leap year baby, so she's really 16. Now, come on, Frank, get straight here. Yeah, so it's great, and I have 4 children and 6 grandchildren. They are all growing up around me, from the age of 12 to the youngest one is 6 months. So it's exciting. It's exciting being a grandpa and having fun and enjoying life.
That reminds me, we had a broadcast on Saturdays and there's one of our, Betty and I have a client who's in his 70s, and one of the young guys said, "Oh, it's amazing, Paul, that you have so much energy." It says, "I'm just, I just at home with the 3 kids." And and I just sort of said, "You don't have to say anymore. You got a whole pile of young kids at home. You're supposed to be tired."
Yeah.
Yeah. So we're, so we were thinking we were going to talk about health insurance, but I think they're all related. So,
They are.
yes.
They are.
And so I don't know if Betty or Roy, do you have any questions to kick this off, or?
Well, yeah, to talk about something I think is very important, this RSSA designation that you've got, Frank. What is the question you most get asked about Social Security?
The question I get most asked is, when should I apply? And that question is really figured out based on several different answers. What year were you born, right? And as an example, if you were born in 1956, then your full retirement age is 66 and 4 months, as an example. If you were born in 1960, then your full retirement age would be 67. And I say that because if you're taking Social Security before full retirement age, then you are losing money because you're leaving a lot of the money with Social Security. Example, if you took it at age 66, you're really only going to get 93% of what you're eligible for. If versus waiting to full retirement age, you'll get 100%. So if you're going to get, $1,000 of benefit, it's going to be reduced to, $900 as an example. So those are real important things. But then also this question that goes with that question is, what is your life expectancy? And people say, what do you mean, what's my life expectancy? Well, do you have one of the 4 horsemen being involved in your life, such as, do you have cardiac issues, heart problems? Are you a diabetic, type 2 diabetic? Do you have kidney problems or liver problems? Because those can shorten your lifespan, which would mean maybe it is to your advantage to take your Social Security at a younger age, at age 62, 63, 64, etc. So you could get the maximum out of it. And then the third thing that I mentioned on this is, what about you and your wife? Which one of you is the highest income earner? Keeping that in mind, the higher income earner, it would be more beneficial if you could take yours all the way at age 70, and your spouse could start taking hers early, because if something happens to you prematurely, then she's automatically going to get your benefit, which would be much higher than hers for a lifetime. So those are some ideas that could help you, better determine, when should I take my Social Security.
That's really good information. I never thought about the husband and wife scenario and the higher income earner. But there's one thing that has always, I don't want to say bothered me, but I don't really know the answer, so therefore it does bother me. I know people that take their or have taken their Social Security at 62.
Yes.
Now, are they stuck for the rest of their life at the lower income?
Yes. If you take it at age 62, you're actually getting 70% of your benefit. And
there's no way to raise that.
You could reverse it up to a year. But if you do, you got to pay back the year that you took.
Okay.
Yeah.
All right. I don't want to hog the conversation here. Betty, Greg, you got some questions for Frank?
Yeah, well, I think what we were just talking about is a really valid point. I'm thinking of a friend of mine who, when she turned 62, said, okay, who knows how long we're here, and started taking her benefits. She's now 84. And, again, no one knows how long we're here, but that was a lot of income that she did not get in the long run, because she didn't wait until full retirement age. So I think it's something for people to really look at. And, again, the point about your life expectancy is a really important one. Remember that Social Security was designed when people's life expectancy was much shorter than it is now. I mean, when the program came out, people didn't expect to live so long.
No, yeah, you started collecting when you died. That was the almost by design. So.
Yes, exactly. It was designed for a short cushion for people at the end of life. Now it's not that. It's a whole other thing that is called retirement, which wasn't really part of the dialogue when it first started as a program.
And if you wait past full retirement age, let's say your full retirement age is age 67, and you wait, each year that you wait, your retirement income benefit goes up 8%. They're rewarding you 8% a year, all the way up to 24% at age 70 from full retirement age 67 to wait that length of time. So you have someone with a long life expectancy and has a good income earner. That's a huge amount of money that individual, he or her, would be able to leave to the surviving spouse on an income basis for their lifetime.
Right.
Which is really good. Now, something else to remember is, and I'm right in the midst of working on this issue for an existing client of mine. He's 69 and she's 59. So there's 10 years age difference. But the key about the issue with this is that they have a 16-year-old child together. And this 16-year-old child together is eligible for benefits if one of the spouses is collecting. So he has been delaying to collect Social Security, not knowing if he could get it or not, or whether it was beneficial for the child and him to have it together. So we did the analysis for him, and what it worked out was that he was able to get retro 6 months for him and his dependent son, and get that going forward until this dependent child, the dependent benefit, will come off and stop being paid out once he graduates from high school, which is about a year. Now he's a little older, 17. So it's about a year and a half away maximum that they got this benefit. So that's a real interesting factor. Some people don't see that opportunity.
To go back to what you were just saying about the wife or the husband can benefit from the other spouse's Social Security benefits, do they get 100% of the other person's Social Security if they live longer?
Yes, you would. Give you an example. My wife's Social Security benefit is right now is going to be about $1,400 a month, and she's taking hers. As I say, she's a leap year baby, but she's taking hers at age 64. So basically what she's doing is she's getting her benefit, but she'll also get 50% of my benefit, which brings her total benefit up to about $1,400 a month. Because she gets half of mine minus what she gets, and then they add that amount to it to give her what it would normally be. So the spouse will continue that benefit during her lifetime and during her spouse's lifetime. But when one of the spouses pass away, you get the higher benefit of whoever the surviving spouse is. You get it from the higher earner's income. So in this case, my wife would get my total Social Security benefit if I pass away first.
But she only gets yours, not yours and hers.
That's correct, Ray. Yeah.
Okay. Understand. Wow. Great information, Frank. Thank you.
No, that's fabulous. I think we can bring the health insurance in here at this point.
Sure.
Let
me mention one other thing.
Okay.
What we're able to do to help people with Social Security is that we're able to take their information and put it into the program, the most current updated program, and we can run all the different analysis. They call it a roadmap. And this roadmap tells them when is the most efficient time to take it, optimize it, etc., and what's the most maximum benefit that you could receive. So it's really neat. It kind of takes the guesswork out of it.
That's great.
So is that something an RSSA can do, and really not anybody else?
Yeah, you have to have the technology and the program to be able to do that.
Got it.
Okay.
Excellent.
So let's say we have somebody, a young couple in their 50s.
Okay.
Yeah. So what, in terms of their considerations for retirement and also their current health insurance, what kind of advice do you have for them?
Well, let's just take as an example. If we have a 50-year-old, let's say the wife's 48, right? A couple of years younger, then depending on where they're working, it's always most beneficial if you can get your benefits paid through your employer, because your employer is required to pay 50% of the least expensive health plan offered through their company for you as an employee, not for your dependents, but for you as an employee. And if this 50-year-old is making enough money, then that employee should be looking at a way to put into a retirement plan. And if you have an employer that has 5 or more employees, they're required to have a retirement plan of some sort. The least expensive is a simple IRA. You can get 401ks also, but the simplest is a simple IRA. And that money, he should be making contributions to that. And his wife, 48, should be making contributions to a retirement plan also. Even if they're not making contributions through their employer, they should be doing a Roth IRA or something along that line.
No, that's great. So
now, one other thing, if depending on their income levels, if they're making under 75,000 for the two of them, as an example, they may qualify for credit and subsidy benefit to get their insurance through Covered California. And you've heard of that. I mean, I don't do any of that because I mean it's a nightmare to deal with Covered California to begin with. It really is. And so I just I want to help people, but I can't be on the phone for 2 hours trying to figure out what they're going to do compared to what they said they were going to do. It's a difficult issue.
Yeah.
But if they qualify, that's to their benefit.
Yeah.
So Roy's in North Carolina and I'm in British Columbia, Canada.
Oh, okay.
Yeah.
Well, doesn't Canada provide health coverage for all of their residents?
Yes.
Yes.
Yeah. You can get some supplementary insurance, but most things, if you end up in the hospital, you're not going to lose your house.
Yeah. Do they call that program there the bogey?
What's that?
The program for health and benefits and retirement in Canada?
No, it's just it's the healthcare. It's a federal program, but each of the provinces manage it their own. So it gives them something to argue with.
Oh, okay. Okay. Yeah.
Yeah. But I mean, but basically it covers all the general things. There are some Blue Cross and a few supplemental plans that you can do. It's sort of more private that might cover a few things that are not covered.
Yes.
But generally, your health, if you end up in needing to see a doctor or a hospital, that's covered. You end up paying for your own medications generally. And, and I don't know what it's like in the US. We have a bit of a problem keeping up with the aging population. So, there's a huge strain on all of the medical facilities all across Canada.
Well, here, once you turn age 65, you're eligible if you've paid into Medicare to go on the Medicare program. Yeah. And the Medicare program is either a Medicare supplement or a Medicare Advantage plan. But, you pick your service. I mean, do you want to see who you want to see? Then you go with the supplement. Do you want to see who they tell you that you can see? Then you go with the Advantage, and you don't pay any money, but you get what you pay for, right?
Yeah.
So it's an interesting, and you can also stay on your employer health coverage, if you want to. But that's questionable whether your employer is going to contribute or not going to contribute once you hit age 65.
Yeah, my wife Bonnie was born in LA, and she has dual citizenship, and her siblings all live in California, and her sister and brother-in-law have retired, and so it's one of these things where if you have, as you say, if you have a company health plan and a retirement thing, you can be in pretty good shape at the end
Yeah,
of it.
and the thing that I'm seeing the most of now, you guys, is that because there's thousands and thousands of people turning age 65 now, going into the retirement is most people don't have any kind of a pension. Used to be people had a defined benefit plan or a pension that was paying somewhere between 70 and 80% of what your normal income was on a monthly basis. That's out the window anymore.
Yeah.
So it's even more and more critical for people to start planning early as to how they're going to have distribution from what they've earned on. And it plays such a big factor when you're looking at distribution as it applies to what you're getting coming in with Social Security or IRA money, or money that you've saved your whole lifetime to use when you're retiring. So that's a real important piece to look at the distribution of the money as
Right.
it's coming to you, other than the sources that you've put into it,
That's great.
Yeah.
And
Valuable insights in this conversation today, Frank. Thank you.
Well, I'm glad. I'd be happy to come back if you want me to come back sometime and talk on something else. I'll mention one thing that's really exciting to me. We're all looking to help people and to grow our business. I was able to connect with the right person and the connection person with a large association for nurses. So we're going to be doing this kind of presentation to these nurses, the lifeblood of our medical industry, to help them planning for retirement and help them planning for going into Social Security. I'm real excited about that. We'll be doing webinars for them starting in May.
oh, that's great.
Yeah.
I just posted here in the chat your LinkedIn profile page. So that's probably one of the best places to contact you. It's a good place to start.
Oh yeah, perfect.
And any other place, or is that just a really good place for people to go?
That's a good place for people to go. I mean, I all of my contact information is there, and they'll get a hold of me. People can call me if they'd like to. I can give you my email and phone number if you'd like. I mean, that's doable too.
Yeah, I noticed you have an appointment button on your profile.
Uh-huh.
So congratulations on your profile.
Thank you.
It's actually pretty good. That's one of the things we do is review, and not all profiles are created equal.
You guys are wonderful. You're wonderful. Thank you. Thank you.
Yeah, no, perfect. Well, thank you for coming and sharing today. And actually, I would think almost anybody listening could probably do well to talk to you, because I think most of us are not in as good position with our Social Security and insurance situation as we probably could be.
Yeah, well, God has gifted me with the ability to help people, and I grew up on just a very, very slim means of income. And now that God has blessed me so abundantly, I mean, I want to help others. However I can help them. If I just listen to them and give them a couple ideas that they can help themselves, that's good. And if they use my service, that's great too. But, karma goes a long way in life,
Yeah.
Absolutely.
So where did you come from? Where were you before you came to California?
I was in New Mexico.
Yeah, where in New Mexico?
Actually, I came from Fort Sumner, New Mexico, where Billy the Kid supposedly
Yeah.
buried and where the grave is at. Yeah.
Oh yeah. I love New Mexico.
Oh, beautiful state. Oh gosh.
Yeah.
Yeah.
It's
So
kind of funny when you're driving from Texas into New Mexico and you hit the sign. What do
Yeah.
they call it? The Enchanted State or something like that. It
Yeah.
it feels like you've gone into a new universe when you go in
Land of enchantment, they call it.
Land of Enchantment. Yeah.
Yeah, yeah. That's good. That's good. It's a wonderful place. Yeah.
So
Any
you
other?
can help somebody in any state as far as Social Security information is concerned. Is that
Yeah.
correct?
Yeah, we can help them whatever state they're in. The Social Security laws are basically all the same.
But as far as health or financial services, you're probably restricted to a state or certain states for that,
Well,
right?
basically, I'm in California, Arizona, Nevada, Utah, Idaho. What other state am I in? That's it, I think.
Yeah, and you can give advice that applies to most of those states anyway.
Oh yeah, and if we need to help somebody with a product or something, California is one of the most difficult states to get licensed in. So it's pretty simplistic to get your licensing appointed and with another company or a company in a different state. It's not that hard. If somebody needs help, we're here to serve.
Well, thank you so much for coming and talking to us and
Okay.
providing us with all this great information. We really appreciate it. I'm
I,
sure
appre-
our viewers will too.
I appreciate the opportunity.
That's perfect. Your timing's perfect too.
Okay.
Anyway,
You guys have a wonderful weekend.
okay, we'll do. You too.
Yeah.
Right.
Thank you,
Bye-bye.
Frank.
Thank you.